Okay, in these uncertain times with COVID-19, employees can feel very anxious about should they go into the workplace. Potentially they're having symptoms and they're unsure if they should go, or they're worried about their employees infecting them. And so in these uncertain times, Axiom Medical has created a comprehensive coronavirus screening program that can quickly and efficiently determine if you should go into the workplace based on either your exposures, your travel history, or your symptoms. So when you look at if someone actually has COVID-19 and then has recovered, what's their chances of getting sick again with the same type of disease? I think that information is still being developed in the medical community in allergy and immunology. I believe experts right now at this point feel that there is immunity that will be developed in people who actually get the disease and recover. And so my general thoughts are that you would have immunity towards this disease, but we don't have specific data to support that claim at this point. So once an employee has experienced the disease and is preparing to return to work, a lot of discussion can be, do you need a negative test to return to work? What do your symptoms look like before you can return to work, etc. So some talking points about the importance of return to work testing. So certainly you want to be asymptomatic, meaning you don't have fever, chills, cough, shortness of breath, any of those symptoms for at least 24 hours before returning to work. Regarding specific laboratory testing for this disease, at this point, lab testing is quite limited, and so those tests will be reserved for the sickest or highest risk populations. So it'd be really important to partner with a company that can help provide a return to work exam that is very specific about returning you after an illness like this. So regarding COVID-19 and preventing the transmission of this disease, the general principles you want to think about is really limiting your exposure to others as much as possible. So in the workplace, if it's all possible and you can telework, that's really the best option. However, if you're critical infrastructure, your job is critical to the activities of the company and for the general public, a lot of us will still be going into the workplace, and so really you want to keep distance from those you work with at 6 feet. Try not to spend prolonged times with them. Really guiding what the CDC considers close contacts. So again, close contacts by the CDC is considered closer than 6 feet and then spending a prolonged time period with them. However, it's really hard to really specify for a workplace if you should avoid gatherings of 50 or more. But I would just say if it's absolutely necessary. So when you think about how long a virus can stay potentially infective, in the environment, I think specifically for COVID-19, data isn't readily available to provide a really accurate estimation for this time period, but I think the general consensus at this point would be it would last less than a day. So if you can do periodic environmental cleanings, say twice or 3 times a day, that would provide good coverage of cleaning up the environment and minimizing the exposure from those environmental risks. So an interesting consideration now is that with COVID-19 being a more severe contagious respiratory disease than we're used to with the common cold or flu, a lot of the practices that we're incorporating now to have the best posture to prevent this spread of disease in the workplace, should we continue these efforts once this one risk goes away? And my opinion is yes. So Obviously, you want personal hygiene where you're not coughing into your hand, you're not coming into work when you're sick, and maybe even seeking screenings to determine if you're contagious before coming into the workplace. And so I think the best practices that we're laying a foundation for as culture in the workplace should be a great avenue that we continue down for future seasonal illnesses like the flu.